On behalf of HepUnited, I wanted to thank you for joining today's webinar. My name is Kate Moraris, and I'm the Senior Program Director at the Hepatitis B Foundation and Director of HepUnited. The Hep B Foundation is a co-lead of HepUnited with the Association of Asian Pacific Community Health Organizations, APCHO. As a collaborative effort with the National Viral Hepatitis Roundtable and the White House Initiative of Asian Americans and Pacific Islanders, we're excited to present you with today's webinar on viral hepatitis preventive services and the Affordable Care Act. Just to give you a little bit of an overview of our organizations, HepUnited is a national coalition to address the public health challenge of hepatitis B, which is the leading cause of liver cancer and a major health disparity among Asian Americans and Pacific Islanders. The National Viral Hepatitis Roundtable is also a coalition, a broad coalition working to fight and ultimately end the hepatitis B and C epidemics. NVHR seeks an aggressive response from policymakers, public health officials, medical and healthcare providers, the media, and the general public through advocacy, education, and technical assistance. And our other co-host is the White House Initiative on Asian Americans and Pacific Islanders, whose mission is to improve the quality of life of AAPIs through increased participation in federal programs. And thank you so much to NVHR and to the White House Initiative for co-hosting today's webinar. We'll be discussing implementation of the U.S. Preventive Services Task Force, hepatitis screening recommendations, and viral hepatitis preventive services under the Affordable Care Act. Before we get started, I wanted to review a few housekeeping items and let you know how you can participate in today's Hangout. There is a phone and audio option, and the call-in numbers are on your screen, as well as the access code. An audio PIN number is shown on your screen as you log on. This will reduce any background or echo noise. You may submit questions in writing, and we encourage you to do so during the presentations. Please type them in the question box on your GoToWebinar control panel. We'll be reviewing them as they come in, and we'll also hold a Q&A period after the presentations. And finally, today's webinar is being recorded. You'll receive an email with a link to a recording of today's presentation along with a copy of the presentation slides. So I wanted to go ahead and introduce our speakers today. Joining us are Michael Byun, who's a commissioner on the President's Advisory Commission on Asian Americans and Pacific Islanders. Michael's also the executive director of the Asian Services in Action in Akron, Ohio. Our second speaker is Ryan Clary. Ryan is the executive director of the National Viral Hepatitis Roundtable. We also have Deborah Holtzman. Dr. Holtzman is the associate director for science at the Division of Viral Hepatitis within the National Center for HIV/AIDS, Viral Hepatitis, STD, and TB Prevention at the CDC. And finally, we have Isha Weerasinghe, who joins us as senior policy analyst with APCHO. And with that, I'll turn it over to Michael Byun for introductory remarks from the President's Advisory Commission on APIs. Michael?
Hi, good afternoon. Thank you, Kate. Thank you to the Hep B United, National Viral Hepatitis Roundtable, and APCHO, the Association of Asian Pacific Community Health Organizations, for organizing this webinar. On behalf of the President's Advisory Commission on AAPIs and the White House Initiative on AAPIs, I just again want to say thank you to all the partners who are putting this webinar together and to the speakers who are going to be talking today.
And
just a little
groups that you
excuse me. Just a little bit on the initiative, the White House Initiative on the Asian Americans and Pacific Islanders and the White House Advisory Commission. On October 14, 2009, President Barack Obama signed the Executive Order 13515, renewing the White House Initiative on Asian Americans and Pacific Islanders. The Executive Order establishes the President's Advisory Commission on AAPIs. It also establishes the White House Interagency Regional Working Group, and then the White House Initiative on Asian Americans and Pacific Islanders. The initiative itself is chaired by the U.S. Department of Education. It is housed in the Department of Education, and is chaired by Secretary Arnie Duncan, and is led by Executive Director Karen Ahuja. And as Kate mentioned before, the main focus of the work that the initiative does and what the President's Commissioners do is to facilitate opportunities for AAPIs to connect closer to federal programs and agencies to address quality of life and opportunities. Certainly the passion and commitment that you have has led to the slow but steady progress of federal government to recognize and respond to the issue of viral hepatitis B and C and the needs of those affected. Indeed, while we know that there's still further things to work on, the 2013-2014 decisions by U.S. Preventive Services Task Force to upgrade to a B grade for hepatitis B virus screening for persons at high risk for infection and hepatitis C virus screening for persons at risk for infection, and one-time screening for adults born between 1945 and 1965 or baby boomers is tremendously important, and you should all be very, very proud of your work. I also think that today's discussion is timely in that we have now completed the first full year and 2 rounds of open enrollment in the Affordable Care Act health insurance marketplace. We know that the law is a resounding success with more than 16 million people gaining health insurance, with 2 million who are AAPI. However, we can also see that there remains to be work done to make sure that everyone who needs greater security in their health care receives it. So I want to turn it over to the rest of today's speakers so that they can share where we have made progress and where there remains work to be done. As I close, I want to thank again the advocates and leaders who continue to raise the points of need and gaps in care that exist for our communities. And please know that the initiative and the Commission continue to support you in these efforts. Thank you so much.
Thank you, Michael, and thank you for your partnership. We'll now turn it over to Ryan Clary, who will provide an overview of the viral hepatitis preventive services within the ACA and implementation priorities. Ryan?
Great, thanks, Kate, and thank you, everyone, for being on this webinar. I know it's been a very busy and exciting month for all of us with Hepatitis Awareness Month and Hepatitis Testing Day, which we honored this week. So I want to thank all the organizers for putting together this very timely and important webinar. I'm just going to spend some time covering some of the, or really elaborating on what Michael talked about as some of the successes we've seen under implementation of the Affordable Care Act, particularly in the area of viral hepatitis preventive services. Some of the successes, opportunities, and I'll just touch on some of the challenges that Isha will be going into more depth around that. Next slide, please. So Michael touched on this, and before we go into preventive services, I really wanted to highlight as kind of a review for everyone on why the Affordable Care Act is so important for our communities and has been so important. I know there have been some challenges with implementation, and as Michael mentioned, we have a ways to go to make sure that everybody has security and health insurance. But really, the Affordable Care Act is the largest expansion of care and treatment and preventive services around hepatitis B and hepatitis C. We've seen expansion of care through Medicaid expansion in 29 states plus the District of Columbia. 4 additional states are considering expansion. Then we've got 17 states we really need to work on and make sure they expand their Medicaids. We've seen expansion through the exchanges and private insurance and financial assistance available for folks who need it. We've seen a strengthening of the community. Can we go back to the left, please? We've seen an expansion of the community health clinic system. Can we go back to the previous slide? Excellent, thank you. Through increased funding and support for community health centers, and I think we all know how vital that system is for the communities we advocate for and represent. Probably the biggest victory is we no longer have discrimination against pre-existing conditions, so someone cannot be denied coverage because of a pre-existing condition such as chronic hepatitis B or chronic hepatitis C. We're seeing great expansion of coverage of preventive services with no copays, and that's what I'm going to dig into a little bit deeper. We've seen some success in getting increased funding for viral hepatitis through the Public Health and Prevention Fund, which I'll talk about, and then there's a priority in the reduction of health disparities, also something very, very important for hepatitis and hepatitis C. Next slide, please. So here is a list, and Michael talked about some of these successes, and it's really neat to look back on the previous few years of all of our collective advocacy. And when I say we, and I'm going to say that a lot in this presentation, that's a collective we. The hepatitis B and the hepatitis C community has advocated so strongly for expansion of preventive services to the ACA, and we've seen really great gains. One of our first successes was expanded coverage of hepatitis B vaccination, and I'm going to go into all of these in more detail. Last year, we saw the updated U.S. Preventive Services Task Force's hepatitis B screening recommendations, which really expands the list of at-risk groups who are recommended to be screened for hepatitis B. And that updated recommendation has led to expanded coverage of hepatitis B screening. The year prior, in 2013, we had a great victory around updating the U.S. Preventive Service Task Force's hepatitis C screening recommendations, getting recommendations both for screening at-risk individuals and a one-time test of baby boomers, everybody born from 1945 through 1965, as Michael mentioned. And then recently, a couple of years ago, we were able to secure $10 million of badly needed funding for viral hepatitis services through the Prevention and Public Health Fund, and that's now incorporated into the base funding for the Division of Viral Hepatitis at the Centers for Disease Control and Prevention, and I'll talk about that and what that means. Next slide, please. So just going into each of these a little bit deeper so folks understand the impact of this great advocacy, starting with immunization. So under the Affordable Care Act, any immunization service that is recommended by the Advisory Committee for Immunization Practices, a group of experts that reviews these practices, looks at the data, looks at the research, and makes recommendations. Any service that's recommended by this body is covered by many public and private payers under the Affordable Care Act. In this case, for hepatitis B, we're talking about universal vaccination of infants, vaccination of children and adolescents who are not previously vaccinated, pregnant women who are identified as being at risk for hepatitis B infection during pregnancy, unvaccinated adults at risk for hepatitis B infection. And this last one is really key. Basically, anybody who requests protection from hepatitis B infection, anybody who goes in and says, I would like to be vaccinated, is really considered an at-risk individual and is covered as well. So when I say it's covered with no pay by most private insurance plans and expanded Medicaid programs, what I mean is it's pretty much all private insurance plans. There's a caveat in the Affordable Care Act that private insurance plans that are considered grandfathered or that existed before the Affordable Care Act was signed into law and haven't undergone significant changes are exempt from some of these rules, but private insurance plans that existed have gone through changes. So we're really talking about the overwhelming majority of private insurers now have to cover this service at no copay for people who are beneficiaries of that program. Also, expanded Medicaids have to cover these services. Now, these are the states, which are 29 states plus the District of Columbia, that expanded their Medicaid, that chose to expand their Medicaid to bring in more low-income adults into their program. And under that program, the Affordable Care Act requires that these services be provided at no copay. Where it's optional is states' traditional Medicaid program, which is the Medicaid that existed in all states and the District of Columbia before the ACA was implemented. In this case, states sort of have a two-tiered program. They have a traditional Medicaid, expanded Medicaid. Many states are moving to make sure that services are equal between the two programs, and some states aren't. And we're having a little bit of trouble understanding how this impacts hepatitis B and C preventive services, and I'm hoping soon we'll have that information. But that's the one area where we need to work on. States is under their traditional Medicaid, they're not required to cover these services at no copay, even though many of them are. Next slide, please. So in the case of hepatitis B screening, this is probably one of the biggest victories we've seen in a very long time. And a year ago, when if we were to have this webinar, we were right in the middle of that battle. An early victory, of course, was when the U.S. Preventive Services Task Force, which is a body of experts, just like the Immunization Committee I talked about, but this is a different body that looks at screening services and preventive services and makes recommendations on whether or not various groups, there's a benefit for screening and preventive services for certain diseases and certain health conditions for certain groups. And if they give an A or a B grade, which is sort of highly recommended or recommended, those services must be covered by the programs that I described earlier. So an early change was the USPSTF recommended hepatitis B screening of pregnant women in 2009, so that was an immediate benefit for us. We had the change last year where the USPSTF went from not recommending testing at-risk adults and adolescents for hepatitis B and now gave a B grade to testing at-risk groups. I know Dr. Holtzman will talk about who those different groups are. Very, very significant under the Affordable Care Act, because now covered with no copayment by the programs that I described. The one area that's pending for us is whether or not Medicare will cover this service. Under the Affordable Care Act, if Medicare decides to cover a preventive service that has an A or B grade, then it must provide it at no copay to the beneficiary. However, it's not automatic. We have to request that the Medicare consider providing the service, and we're actually in the middle of doing that. Many of you have seen and signed on to a sign-on letter that we've all been circulating, asking Medicare to look at this. That letter's open for a couple of more days, so if you haven't signed on and you're interested, please get in touch with me. Just email info@mbhr.org or ask Kate or Isha, and we'll get that letter to you for your review. Next slide, please. So in the case of hepatitis C screening, it's about a year ahead of hepatitis B because we were able to get the change by the USPSTF a year earlier. Getting the B grade for one-time testing of baby boomers was a huge victory. We actually changed a draft C grade to a B grade through the public comment period by organizing a lot of public comment and sending additional research and data, and the task force changed its mind, gave a B grade. So now, those who are really at risk, we know that baby boomers are heavily impacted by hepatitis C. In a lot of programs are now covered for a test. In addition, people at high risk for hepatitis C, that's people who use drugs, people who've had unregulated tattoos, a whole host of risk factors that I know Dr. Holtzman will go into. And again, these are the areas where folks are covered with no copay. Most private insurance plans, expanded Medicaid programs, optional coverage by traditional Medicaid. And in the case of Medicare, we were actually able to secure a notice from Medicare indicating that it will cover hepatitis C screening of both baby boomers, one-time test to baby boomers, ongoing test to folks at risk, at no copay to the Medicare beneficiary. So that was another great victory that we all secured, with the one caveat that the test has to be ordered by a primary care provider. And that was a little disappointing to us because we know that there's other arenas in which folks can and should be tested. The emergency room really stands out as one. And so we continue to try to work to see if we can have flexibility around that. Next slide, please. And so this is another victory that I think we don't talk about enough, and it really paved the way for some very significant increased funding for the Division of Viral Hepatitis at CDC. The Prevention and Public Health Fund is part of the Affordable Care Act. It pays yearly investments to provide expanded and sustained national investments in prevention and public health to improve health outcomes and to enhance healthcare quality. So really funding areas to advance wellness in the United States. And a few years ago, Viral Hepatitis Advocates really looked at this as a possibility to get some badly needed increased funding because we weren't having as much success through the yearly appropriations process. And we were successful in fiscal year 2012 and fiscal year 2013 in securing $10 million specifically for viral hepatitis from this fund. And Dr. Holtzman will talk about how that funding's been used. And what's great is the funding's now been integrated into what we call base funding. So now when Congress looks at funding for the Division of Viral Hepatitis every year, that funding is just included in the pot of money that it looks at. We don't have to keep trying to get from the Prevention and Public Health Fund. And it's really gone a long way in increasing hepatitis B and C testing and linkage to care services. Next slide, please. And so for my final slide, and Isha's going to talk about a lot of these areas, I just wanted to highlight areas where we're still trying to do a lot of advocacy to try to expand viral hepatitis preventive services and where we can use a lot of help. So if anybody wants to get involved, please get in touch with us. I talked about Medicare coverage of hepatitis B screening. I'm very optimistic about that, but we have to go through the process. I talked about how we're trying to expand Medicare coverage of hepatitis screening so that it could be reimbursed outside of the primary care setting. That will take some work as well. We need to really look at Medicaid coverage in traditional programs of hepatitis B and C screening, really understand which states are including these services as well in addition to their expanded programs. I think we should always have on the front of our minds the fact that there remain many, many uninsured people, whether it's because they're in a state where there's no Medicaid expansion or they're undocumented or for whatever reason folks are not insured, that we are continuing to fight for services for them, including preventive services. And then, of course, adequate federal funding, which is a yearly and sustained fight to make sure that the funding is there to be able to implement these programs. And so with that, I will turn it back to Kate.
Thanks, Ryan, for that great overview. We'll now turn over to Dr. Holtzman, who will talk about CDC's role in implementing viral hepatitis preventive services.
Okay. Thank you, Kate, and thank
you. All right, you have the controls.
Okay, thank you, and thanks for the invitation to participate in the webinar. I'm going to talk about CDC's role in implementing viral hepatitis preventive services. Oops, sorry. I'm sorry, Kate, it's not advancing. Thank you. Okay, these are the 4 areas that I'm going to touch upon in the next 10 minutes or so, and these are all in relation to our efforts to combat hepatitis B and C. I'm going to talk about our recommendations, education and training, our demonstration projects, and our efforts to build capacity to expand models of testing, care, and treatment. Next. Okay, first, however, though, I wanted to show some of the goals we're working towards with respect to hepatitis B and hepatitis C. In 2011, HHS, in collaboration with other federal agencies, but most notably, our division, the Division of Viral Hepatitis at CDC, we worked to prepare the first National Action Plan for the prevention, care, and treatment of viral hepatitis. And then last year, the plan was updated for 2014 to 2016. And as shown on the slide, these are the targets we hope to achieve by 2020. We'd like to increase the proportion of persons who are aware of their HBV infection from 33 to 66%. We want to increase the proportion of persons who are aware of their HCV infection from 45 to 66%. We want to reduce the number of new HCV infections by 25% and then eliminate mother-to-child HBV transmission. Our rationale for viral hepatitis testing, and really this is our rationale not only for testing but all of our preventive strategies for hepatitis B and C, is shown here on this slide. We have an estimated 3.5 to 5.3 million Americans that are living with hepatitis B or hepatitis C, and about 1/2 of those persons living with hepatitis B or C do not know that they are infected. Testing, knowledge of infection status, care, and treatment can vastly improve the health outcomes for these individuals. Okay, these are the strategies that I'm going to highlight in the remaining slides, and this includes, again, the testing recommendations. We'd like to broaden these recommendations. We want to educate communities and train providers. We want to build capacity for testing and linkage to care and treatment, and develop and expand effective care and treatment models. And with regard to testing for hepatitis B, the CDC and the U.S. Preventive Services Task Force recommend, and Ryan had mentioned this, all pregnant women should be tested routinely for hepatitis B during our early prenatal visit. Testing should occur in each pregnancy even if the woman has been previously vaccinated or tested, and women should be retested at the time of admission to the hospital for delivery if risk factors are present. In addition, populations with higher rates of hepatitis B should be screened for infection, and this includes persons born in countries and regions with a high prevalence of hepatitis B virus infection, U.S.-born persons not vaccinated as infants whose parents were born in regions with a high prevalence of HBV infection, HIV-positive persons, injection drug users, men who have sex with men, and then household contacts of persons with HBV infection. I'm going to, let's see. I'm sorry, Kate, it doesn't seem to be moving. Thank you. Actually, I'm going to skip this slide because Ryan went over that. Thank you. Okay. Then for hepatitis C, CDC and the USPSTF recommend HCV testing. They recommend one-time screening for persons born from 1945 to 1965, again, the baby boomer cohort. And then anyone with past or present injection drug use, this is the primary risk for HCV infection. And then other risks include receipt of blood or organs prior to June of '92, receipt of blood products made prior to '87, if someone was ever on chronic hemodialysis, infants born to HCV-infected mothers, intranasal drug use, unregulated tattoos, or a history of incarceration. In addition, there are medical and other clinical indications for testing, such as a persistently elevated ALT level, or someone with HIV. Annual testing for HCV is recommended. Okay, and I'm going to skip this one too because Brian already went over that. Okay, education and training is another important prevention strategy, and this slide illustrates our No More Hepatitis campaign, which was launched in the summer of 2012. And the goals of the campaign were to increase awareness of hepatitis C among the public and among healthcare providers. And we also have a similar campaign for hepatitis B. And these campaigns employ a number of strategies, which include outreach to news media. We have print ads, billboards, outdoor ads, print and dioramas. You may have seen some of those at some of the airports around the nation. We have broadcasts, including radio and TV, and use of social media, Twitter, Facebook, and blogs. In addition, we have a web presence, which includes our campaign sites, and then we also actively engage our partners to assist with our education efforts. And this next slide shows, these are some of the materials that we've created and distributed in the last few years, both for hepatitis B and C. And then we also train healthcare providers in HBV and HCV testing and clinical care. We provide tools for providers for screening and diagnosis, information on evaluation and staging of disease. We have treatment guidance. Now for hepatitis C, the IDSA and the AASLD have published treatment guidelines online for hepatitis C. Those are relatively recent, but it's sort of a moving document, and those are updated constantly with the new treatments that are coming out. There's also training for special populations that should be tested. And another critical national effort is to support capacity building for early identification of persons living with hepatitis B or hepatitis C and linking these persons to care. Several projects were initiated to start building this capacity, including a large project that was completed during 2012 to 2014, and this was supported through the Public Health and Prevention Fund. And this was carried out. We had 24 project sites that we funded for hepatitis C testing and linkage to care. And as you see on the slide, these are the settings that we set up where we supported those programs. And then for hepatitis B testing and linkage to care, we had 9 sites that were funded. And a wonderful example of capacity building and assuring a competent workforce is a project also supported by the Public Health and Prevention Fund. It was one of these projects that I just mentioned. And this project was built on the evidence-based model ECHO, which stands for Extension for Community Healthcare Outcomes. And this model's been replicated in several states to expand primary care provider capacity by training and supporting primary care providers to test, care for, and treat persons with HCV infection, and using video conferencing and case-based learning. And this is a particular benefit for primary care providers that practice in rural areas. And this, wait a minute. Okay, we did publish the findings from this study, and they were published in the MMWR in a report. This came out last year for Hepatitis Awareness Month. And this project, these data are from September of 2012 to February of 2014. And this project was successful in training 66 primary care providers, and predominantly from rural settings. Most of the primary care providers had no experience in HIV care, and of 280 patients that were part of this program, 129 or 46% received treatment, and that was more than twice of what was observed in other CDC studies that we carried out. Okay, this next slide shows another ongoing project designed to build evidence and identify best practices for improving HCV testing, care, and treatment and cure. And this is a cooperative agreement between CDC and 3 grantees, each of which is a coalition of public health, academia, and primary care. And the goal of this project was to develop a package of services to improve healthcare capacity through testing and cure. And this is being conducted through each of the 3 grantees is to identify and educate a target population, incorporate HCV testing into primary care practices, implement regular consultation of primary care providers with specialists, HCV specialists, conducting case management, monitoring outcome and community impact via data systems, and developing strategies to reduce patient cost, including assistance in enrolling in public or private insurance. And we have a similar program for hepatitis B for testing and linkage to care. And this program is operating. It started last year from 2014 to 2016. And 3 sites funded to improve the capacity of providers and other stakeholders to increase the identification of foreign-born persons with chronic hepatitis B virus infection and link them to care. And each of our partners will implement the following interventions. They'll recruit foreign-born persons and screen for hepatitis B. They'll coordinate community outreach, provide patient navigation and other support services, increase awareness among the community, the public, and health professionals, and provide training on screening, monitoring, management, and referral practices. So these are going on right now. And these are the 3 sites I just kind of gave a little more information about the program for hepatitis B testing and linkage to care. These are the 3 sites. We've got a community-based organization, an academic medical center, and a teaching hospital. And then these are the specific sites and the populations that they're targeting, all foreign-born. These are also shows the coalition partners, the interventions, and how they will monitor and evaluate the project. And all three are using electronic medical record data. Thank you. That's all I have.
Great. Thank you, Deborah. And finally, I'll turn it over to Isha Weerasinghe, who will discuss next steps and how everyone can get involved.
Thank you, Kate. Hi, everyone. So just to give you a little background on APCHO, APCHO is an organization that represents 35 community health centers located nationally, including 29 federally qualified health centers. And what makes our health centers different from the average health center is that our health centers serve primarily Asian Americans, Native Hawaiians, and Pacific Islanders. And something that we've seen in our health center, our member centers, is increased rates in hepatitis B because of the disproportionate rates of Hep B and AAPIs, which is why Hep B is a priority of APCHOs. So I'm going to go over specifically next steps in terms of the USPSTF recommendations, and Ryan and Dr. Holtzman gave a really great foundation, and I'm going to reiterate some of the things that Ryan had gone over in his slides. If there are other questions that you all have about ACA, I'm happy to address them in the Q&A. So this is just an overview of what we're looking at in terms of the USPSTF screening guidelines in hepatitis B. So as Ryan had mentioned, we were able to get a B grade for at-risk populations, which was released in 2014, and now basically it just means that depending on the payer that things are really complicated. So for hepatitis B, as Ryan had mentioned, May 2015 is when the health insurance marketplaces have Hep B services, Hep B screening services to be covered without copay. And then for hepatitis C, the process started a year before, and that process was for screening for baby boomers. So I am going to go over most of what we can do in terms of next steps in the slides ahead, but this is just to give you an overview of what how the complicated nature of this. I worry sometimes that it was a great victory for us to get a B grade both for hepatitis C and then for hepatitis B for these at-risk populations, but we really need to, now is the time that because the door has now started to open, that we need to leverage this time to push the different payers to ensure that the screening services will actually be covered without copay. So I'm going to go to the next slide. Yeah. So in terms of Medicaid cost sharing, basically, and Ryan had gone over this in his slides, it depends whether there is going to be no cost sharing or not. It first of all depends on whether the state has expanded Medicaid, and then second of all, for those who have are beyond the 138% of federal poverty level, they would be covered in expanded Medicaid states. But as Ryan had noted, for those who have traditional Medicaid, it's really unclear, and we're trying to figure that out now. So this chart is showing you all, and we started looking at those states that are Hep B United members, or those coalitions that are in states covered by Hep B United, looking at whether the state has expanded Medicaid and whether they've applied for federal matching. So if a state has expanded Medicaid, they are able to be eligible for 1% federal matching for preventive services. So the good news is for the majority of these states, they have applied for federal matching, but then in taking those states that have expanded Medicaid, when we look at Illinois and Maryland, they have expanded Medicaid, but they have not applied for federal matching. So for Maryland, that they have a very unique agreement where they're covering USPSTF services anyway. But for Illinois, we're not sure whether USPSTF services are covered. So in the next slides, I'm just going to go over what we can all do to try and figure out like the missing pieces of the puzzle, because it has been quite hard for us to be able to get this comprehensive information, and this information in this chart is actually pretty new to us. And then just looking at Texas, you know, that also is a really unique situation because that is a state. Texas, of course, is a state who hasn't expanded Medicaid yet, and therefore cannot be eligible for federal matching for preventative services. And therefore, we don't know whether they have a unique agreement or not, and the chances are that they don't have a unique agreement to ensure that USPSTF services are covered. Next slide, please. Actually, can you skip 2 slides ahead? So just to follow up on that table, if your state did not apply for the 1% federal matching, and then understood that not all states are covered on that chart, but we're just trying to start with states that have higher rates of, where we've seen higher rates of Hep B, and then working from there. So if your state did not apply for the 1% federal matching for preventative services, the suggestion that I have is to inquire with your governor's office as to why they haven't applied for federal matching, and if and beyond that, try to think about interesting ways that you can have potentially a sign-on letter with your coalition and with your partners to appeal to get your governor's office to apply for federal matching services for preventive services. If it's unknown whether your state covers USPSTF services for Medicaid, you could help us by trying to figure out whether your state covers it by contacting your governor's office and your state Medicaid offices as well. Again, as Ryan had mentioned, and I mentioned in that first slide, it is very confusing in terms of whether those who have traditional Medicaid are covered, have USPSTF or preventative services covered, and we're really trying to figure that out. So as much as you all can help us to try to inquire within your states, that would really be helpful for us to create that national picture. And also, I just would add that besides inquiring with your governor's office, if you could also supplement that by asking your state and national representatives to inquire with governor's offices to figure out why they may not have applied for federal matching services, and what the next steps are, what they can do to help you. So can you go back 1 slide? Thank you. So in terms of Medicare, Ryan had gone over this as well. For the Hep C, there has been a national coverage determination that went into implementation in January of this year. But on the Hep B side, we're in the process of applying for a national coverage determination process, which will take 9 to 12 months from the point that they agree to consider the NCD. So during this process, what we really need is, and this is something that's across the board for Hep B and Hep C, is a lack of data. And we may have community level data, but we need to ensure that we promote that data, especially with the federal agencies. So during the process of this 9 to 12 month process, and particularly if you are able to get that data to us earlier, if you have hepatitis B data that's preferably disaggregated by race and ethnicity for those populations that are 65 and older. Please share that data with us, or try to, and I completely understood that there are issues with data sharing, but if there are ways that you can provide that information to us, that'll help us to better make the case for the national coverage determination. So this was in the first slide. What's happening right now is that Hep B screening is only covered in Medicare for as a confirmatory measure, but it's not covered as a screening, as general screening for at-risk populations. So we want to make sure that the Medicare screening coverage reflects what is shown in the USPSTF and also with the CDC recommendations. So if you could skip 2 slides ahead. Thank you. So in terms of what you can ask us for, please feel free to ask us for letter templates, and in terms of, and by us I mean me or Kate or Ryan, for letter templates in terms of looking at letters to the governor, to letters to your state Medicaid directors, and then you can, of course, ask us about what data might be helpful for us to prove the case that Medicare should cover Hep B screening. And one thing I didn't include here is that we also have to think about innovative ways that we can improve provider education. So, and that's maybe an easier ask in terms of thinking about tools that providers can use to look at perhaps, let's say, a map to see what, so in terms of the USPSTF screening in at-risk populations, one of the main groups that is considered at risk is foreign-born populations born in a country of 2% or higher endemicity. So the CDC has this great map looking at that shows those countries that have 2% or above endemicity. So if there were ways for providers to see that map, or easier ways for providers to look at a list of countries and say, okay, my patient is from X country, they are at higher risk for Hep B, I need to screen them. So we have to think about innovative ways to do that. And if you are doing something within your health facility, within your coalition, within your health center, please let us know about that so we can provide that information to our partners as well, and to share those best practices. And then one other thing that I just wanted to respond to when Ryan was talking about vaccination for Hep B. Right now, vaccination, of course, is crucial for Hep B, but we are having challenges in terms of funding. So vaccination for Hep B used to be covered under what is known as Section 317. And 317 was, the funding was cut through and kind of absorbed by the ACA. And it previously covered adults and children for hepatitis B, but now funding is being funneled through the Vaccine for Children program. So a lot of states are now having trouble being able to provide these vaccines for adults. Some states have very unique ways of being able to provide vaccines for adults, but other states are having a lot of difficulty being able to cover both. So my suggestion in terms of 317 funding is, right now it's kind of in a not the best time in the appropriations process, but just alert your state and national representatives about the fact that this is an issue, and that it is an issue for your state if it is an issue for your state. And then there's a great coalition called the 317 Coalition that is facilitated by the Immunization Action Coalition that focuses on 317 funding and increasing 317 funding. And they do a great job of walking through the appropriations process. So if you're interested, please just let me know, and I can direct you to the right people. Next slide, please. So that's it in terms of next steps with the USPSTF, but I just put a link here that was the consumer guidance by the USPSTF, and then in terms of implementation guidance, feel free to ask Kate or Ryan or me if you need more guidance. I know that was a lot of information that I just threw at all of you, but we're happy to walk you through it. Thanks.
Thank you, Isha, and thanks for that great information. Just as a reminder, we'll now begin the Q&A portion of our webinar. Michael Bian had to jump off, but I wanted to let folks know that Chris Harley from the White House Initiative, a senior advisor at the White House Initiative on APIs, is available to answer any questions that you may have. As mentioned in the beginning of the call, we'll start by answering questions to us via the chat box. So if you have any questions, please feel free to submit them now. So I'm going to go ahead and go through some of these questions. Our first question, and I think Ryan or Isha, this might be for you. For the USPSTF, HBV, and HCV screening recommendations, will those tests be covered if they are done anywhere, or do those tests have to be done in a primary care setting in order for them to be covered?
Well, I'll take that. So in Medicare, the test has to be done in the primary care setting to be covered at no copay, the hepatitis C test at no copay to the beneficiary. I don't believe there are the other restrictions in other programs, although I'm guessing it's probably plan by plan in the private insurance system. It's a really good question. It's one we should try to research further. But the only payer I'm aware of that restricts to primary care is Medicare, excuse me.
Okay. Thank you. Our next question is, I guess you might have covered this a little bit, Isha. I don't know if you wanted to expand it. Is there any advice for groups who want to reach out to their state Medicaid directors to talk about the screening guidelines for HBV or HCV?
Yeah,
I guess
so,
sources?
Sorry, Kate.
Yeah, sorry.
No, that's okay. So I would say that you could also reach out to your state Medicaid director. I was just trying to think about what would be the most influential step that you can take, and I think it's maybe better to go to your governor's office, but at the same time, writing a letter to your state Medicaid director is also a good step forward too, just to inquire about what the coverage is for your state if you don't know that already.
Okay, great. Thank you. And this is for Deborah. Project ECHO has been very successful for Hep C care and treatment. Are there any plans for expanding it to address hepatitis B care and treatment?
No, not right now, but that's something we can certainly think about doing. But it is being expanded in the Test and Cure project that I mentioned, the community-based projects that we're doing for hepatitis C. It's being used there and by the, actually I think just one of the 3 sites that are funded. But it's not been thought about for hepatitis B, but it's something we certainly can think about. And I'll be happy to bring that up with the division to discuss.
Okay, great, thank you.
Mm-hmm.
And our next question is, I guess for any of our speakers, what is the role of health plans in terms of their awareness or implementation of the screening guidelines for HBV or HCV?
I'll take a stab at that. Oh, go ahead.
No, go ahead, Ryan. Go ahead.
I mean, I would say, so the law, is that the health plans must offer these covered services at no copay. There's unfortunately nothing in the law that says health plans need to go actually out and actively engage with providers in their network and beneficiaries. That's something we would love to see happen, and I think that's a great advocacy arena for us is to engage with the health plans, but it's not anything that's automatic, so it's something we're really going to have to push with them and explain why not only following the laws is important and reaching out to folks, but the economic benefits of testing folks early and getting them into early treatment.
Great. Thank you. Isha, did you want to add to that?
No, Ryan covered it. That's it. It's just that what may be written by the plans may not be actually fulfilled or implemented. So yeah, just double checking would be a good next step.
Okay. Great. Thank you. Our next question is, this person is from California. Is screening and vaccination covered by Medi-Cal or California's Medicaid program? She wanted to clarify because it sounds like it is not covered for the general public. Just USPSTF A and B.
Yeah, so California is one of the states that actually is taking the increased match that she talked about, the FMAP, and so is aligning its traditional Medicaid with its expanded Medicaid, and so should be covering hepatitis B and C screening and vaccinations that are covered for the risk groups that we identified earlier.
Great. And just to let folks know, we'll share the slides within the next couple of weeks so that you have those as a resource. Isha, will folks be able to see, are you working on the rest of the country in terms of the coverage or Medicaid expansion and FMAP matching?
I wish I could say yes, but not at this time. But if anyone is on this call and wants to specifically have us work on their state, just let us know.
Great, thank you. It's a great chart. Thank you.
Oh, good. Glad.
All right. Any other questions? Okay. So we'll go ahead and wrap up. If there are no further questions, I don't see any in the chat box here. Thank you, everyone, for that rich discussion. If you do have any follow-up questions or would like to reach any of our panelists for further follow-up, please feel free to contact us directly at connect@hepiunited.org. And also, you're also able to reach us through social media on Facebook, Twitter, and YouTube, which we will post a recording of this webinar on our YouTube channel. And I'd like to thank our panelists, Michael, Chris Harley for joining us for the Q&A, Ryan, Deborah, and Isha. Thank you all so much for participating, and everyone for joining us today. Please be on the lookout for a message at the end of this webinar, a survey and a short survey, and we appreciate your feedback. Thank you all again, and have a great rest of the day.
Thank you.
Thank you.